Okay, let's get into the results of the study. So 5 of the 1,200 scans were determined unreadable for whatever reason. The agreement between the two radiologists using what is called a kappa range was between 0.85 and 0.95, which is in the almost perfect range. So they're just comparing in the study when the radiologist read the studies without the others' presence, did they agree? And for the most part, they did. It was, again, almost perfect. Both injury status, meaning trauma and non-trauma, and scan type, meaning upright and recumbent, were found to be statistically significant, with p-value being equal or less than 0.0001, which just means that statistically speaking, the end results of those measurements is significant. It's not just coincidence. It's not the same. There's a significant difference, meaning there's something to be looked at there. The highest to lowest tonsillar level was what you would actually expect. And so non-trauma laying down, again, without gravity, the average height was 2.2 millimeters above the foramen magnum, the bottom of the skull, the area that was measured, and that is measured for the Chiari malformation. The next lowest level would be the non-trauma upright, so that's in gravity, so we would expect things to settle down a little bit more, to be closer to the bottom of the skull where the brain comes out, and that was at 1.7 millimeters above the foramen magnum. And then the third would be the traumatic laying down, again without gravity, but still had the trauma, and that's at 1.3 millimeters above the foramen magnum. And then obviously the worst one being the traumatic upright with gravity, which is what we would expect, and that was at 0.1 millimeters. One of the things that they used, and one of the methods they used in the results to compare all of these is called a Tukey pairwise comparison, and that showed that the trauma patients were statistically significant lower levels of the tonsils for both the recumbent and the upright compared to non-trauma. So again, another comparison, another method to show statistical significance. There was a significant difference between male and females that they found as well. And the tonsillar herniation of 5 millimeters or more was rare and only found in 6 of the 1,195 scans that were read. The group was also analyzed to see the percentage of patients with tonsils with 1 millimeter or more below that foramen magnum, and the results, which is what Dr. Evans just mentioned. The non-traumatic recumbent was 5.7, non-traumatic upright 5.3, and then when those are compared to the trauma recumbent trauma upright, we got 9.3 and then 23.3. So that, again, significant changes going from the non-trauma to the trauma, statistically significant. When looking at the male versus female, the percentage points was about maybe 1 to 2 more for females compared to the males. And that's in table 2 in the research, if anyone's actually looking at the research right now. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.